Good, e Good evening, everyone. Thank you so much for joining. So today's session is on sexual health and type 1 diabetes. Why did we choose this topic? Sexual health is one topic which everybody has doubt on, but nobody knows whom should we talk about it. Even when we go to peer groups, we are scared to talk about it because we feel we'll be judged. But we have so many questions when it comes to sexual health and type 1 diabetes. So I am privileged to moderate this session where we have so many doctors who are treating type 1 diabetes, and they will be helping us understand different issues related to sexual health and type 1 diabetes. If you have any question which you would like to ask, please feel free to post in the chat box. If you don't want to ask with your own identity, just message me. I'll ask it as an anonymous, and feel free to ask any question you have. I'll quickly introduce these doctors, and I'll ask all the doctors to introduce themselves in brief. Okay, Dr. Sanket is back. So starting with Dr. Manisha. Welcome, Dr. Manisha. Please introduce yourself.
Hello, everyone. This is Dr. Manisha. I'm working as an associate consultant in Regency Hospital, Kanpur, and I'm working in the field of diabetes since 12 years now. I did my fellowship in type 1 diabetes from Ohio. So I'm working in diabetes only. That is it. I'm here just to answer your queries. Hope I will add on. Thank you.
Thank you, Dr. Manisha. Thank you for being there always for us. Means a lot to us. And today we have Dr. Ovis from Jammu. He's also doing a wonderful work. So, Dr. Ovis, can you please introduce yourself?
Thank you, Mehak, for this very important and sensitive topic. Just one correction, I'm from Srinagar, not from Jammu.
Oh, Srinagar. Okay.
Yeah. So I specialize in endocrinology, and I'm a consultant in working in Srinagar. And I have a special interest in managing type 1 diabetes. So we have around 500 kids type 1 diabetes. And I recently did my fellowship from Australia, from Newcastle. And so this topic is very important, and I think we'll have a very fruitful session.
Thank you, Dr. Ovis. Okay, next, Dr. Manoj. Dr. Manoj is joining us from UK. So, Dr. Manoj, over to you.
Yeah. Hello, everyone. I hope everyone is fine there. So it is a great sessions to talk about type 1 diabetes and sexual health. I am pediatric and adolescent endocrinology. I am working in Ahmedabad. I work in government setup as well as the corporate hospital. And right now I am in UK due to some work purpose for the 2 to 3 months. So I congratulate Mahek and every doctors and every participants for joining here, because it's very, very sensitive topic about which we are not going to talk much in the with our peers. So here we try to answer all the questions whatever you have. Yeah, thank you very much.
Thank you, Dr. Manoj. Now, next, Dr. Hitesh.
Yeah, hello everyone. I'm Dr. Hitesh from Delhi NCR. I practice in Delhi Government Hospital. I see a lot of patients with type 1 diabetes as well as type 2 diabetes. And I feel that today's topic is very apt for this current situation. Although we know a lot of things about sex, but we don't talk about it. And the sexual health is one of those key topics which we need to discuss today. Thank you, Meg, for this opportunity.
Thank you, Dr. Hitesh. And last but not the least, we have Dr. Sanket. Dr. Sanket, please introduce yourself.
Thank you, Meg, for this wonderful opportunity today. And I'm Dr. Sanket Pendse from Nagpur. I'm a practicing diabetologist here for the past 10 years at my own clinic. And we also run a charitable trust which looks after the treatment of type 1 diabetes children. And we have several children with type 1 diabetes to whom we provide insulin and all the other basic treatment that is required, that is glucometers, insulin syringes, etc. So thank you.
Wonderful. Thank you, Dr. Sanket. Apart from many type 1s, we also have A.K. Vedwal sir from Yogdhan Foundation who has joined us. Thank you, Vedwal sir, for joining us. It's wonderful to have you, because you are not going to be impacted just one person. You'll be impacting the entire foundation, which means a lot to us. Thank you so much.
Ji. It's a really great opportunity to learn this subject because many children are very feel shy and hesitate to learn. So this is, and I request to share the recording so we can share with the camp during the sessions, all these type ones. Thank you.
Thank you. Thank you, Vidwal sir, for joining. Okay, so now I'll be starting. I'll be asking one question each. However, if you feel that there is any important point you would like to add on to the other person's answer, please, you can stop me and I would be happy to let you answer that question. So we'll start with Dr. Manisha. Dr. Manisha, the first question is the most common question. Does type 1 diabetes impact sexual health of male or female?
Obviously, diabetes has a role. Why we consider diabetes needs to be controlled? Because it does not leave any organ of the body. Like what you name the organ, it impacts. So blood sugar needs to be controlled, irrespective of the type, whether it's type 1 or type 2 or anything, it needs to be controlled for that matter. And regarding the impact on sexual health, when diabetes begins to impact the nervous system, that is known as autonomic neuropathy. So in that case, the male will have sexual dysfunction or premature ejaculation or loss of libido. Same would go for the female. The female might have difficulty in arousal or lubrication. And in fact, I did my study, which was mainly with diabetes and sexual dysfunction in females. So half of the female would not talk about their orgasm. So that's important. So yes, it does impact. So needs to be controlled well.
Thank you, Dr. Manisha, for sharing that. What we have learned is sexual health gets impacted if sugars are not controlled. Now we know that controlling sugars is the base of everything. That means if sugars are controlled, it will not impact your sexual health. If the sugars are not controlled, it will not help. If sugars are not controlled, it will impact. If they are controlled, it will not impact. Now, following up this same question, Dr. Oves, our next question is to you. What are some common sexual health issues faced by individual with type 1 diabetes?
Yeah. So I just want to add something to what Dr. Manisha said. See, sexual health and diabetes. It is something that whenever we talk about diabetes, we always talk about complications of diabetes. Like diabetes can get you kidney failure, you can get blind, you can get a heart attack. So these are all complications which we openly talk with the patients, and everyone knows that they come to us, doctor, I want to control my diabetes so that I don't get these complications. But at the same time, the problems which may arise from diabetes, like sexual, these problems are not discussed. Neither they are discussed by the clinicians, nor the person affected with type 1 diabetes is communicating with a doctor. They feel shy, or maybe we live in a society where we think talking about sex or sexual health may, the people may judge them. So I think this is a very important session. So I was reviewing the literature, like I was reviewing one study done in US. Even people in US where the sex education and sex is very common, but even there the people don't talk about their problems, nor the doctor initiates the talk. So it is very important. So as Dr. Manisha said that diabetes can affect each and every organ of the body, so it can also impact your sexual function. So if we categorize both men as well as the females are affected with diabetes, in men, the most common problem they face is erectile dysfunction, which may be true for type 2 diabetes also, and it's a common problem, but this can be an issue. Erectile dysfunction in men, they may have loss of libido, they may have a problem with arousal. So we need to differentiate arousal and desire. These are two different things. So diabetes may affect both of them. So in females, the most common problem they face is loss of libido, followed by problems with orgasm, lubrication. There was one study that I want to quote here. It was published in Diabetes Care. So they did a ethics study. So in which they just found, it was done in females affected with type 1 diabetes. They found that 57% of females affected with type 1 diabetes have loss of libido. Okay. And 51% had problems with orgasm. And 47% had lubrication problems. And 38% had arousal problems. And 21% even had pain. So I think this topic needs to be, we should initiate this topic, but the only question is when. Do we have to ask this question to those who are sexually active? Can we directly ask a person, are you sexually active, or we should only be talking to this with people who are married? So I think maybe we can add this part, because I was thinking that in my patients, when should I talk about this?
Yeah, Dr. Ovis, you can
Yeah.
continue.
Yes. So I think we need to find whether what is appropriate timing, like whether we should be talking about this like at the time of puberty in both the sexes. Like if we look at the ISPAD, they say you should talk about reproductive health as soon as the child enters puberty. You should at least give some concept, like preconception, counseling, conception counseling should be started. So I think maybe that is the time where we should talk about the issue. Maybe we should initiate a conversation with the patients.
Thank you, Dr. Ovis. You have shared some very wonderful statistics for all of us to think about it. And the most important point is talking to doctor. If a patient is not initiating, can doctor initiate it? That was a very important point you shared. Now, something that I see being from India, we are so scared of being judged by the doctors to talk about our sexual health that uh, we all know that we are moving towards modern society where sexual relationships begin even before marriage. But people don't want to talk about it because we are scared that we'll be judged. We all know that it exists. We are seeing live-in relationships, but we are not comfortable talking about it. Which is one problem, that even if a not married couple comes and talks about sexual health, I think we should be more supportive of it, and we should appreciate the person for talking about it, irrespective of not being married. That will encourage more type 1s to talk about it. In fact, even if a person is not sexually active, there should be a certain age, like you said that in SPAD guidelines, there are certain ages. So there should be a certain age where even if the person has crossed that age, we should introduce sexual health issues to them, because sexual health is not only about type 1. Even if a person is not type 1, there are some sexual health issues which are common to everybody, which a person should know about it. So thank you so much, Dr. Ovis, for sharing that. It was very important point you shared. Now coming to next question, Dr. Manoj, this question is for you. How can fluctuating blood sugar levels in people with type 1 diabetes affect their sexual function?
Yeah. So thank you very much, Mahek, for the questions. So as Dr. Oves and Dr. Manisha has answered those questions, to answering my question, first I want to ask all of you, if I want to ride a bicycle, or suppose if I want to ride a motorcycle, then what are the things which I will require? So from the audience, anybody can answer?
Okay. So audience, we have a question for you. If you want, if Dr. Manoj wants to
Yeah.
ride a bicycle, what are the things he will require?
Yeah.
A very important question.
Okay.
Anybody who can share the answer?
Yeah.
We also answer, or like only the participants?
It's okay. I will answer then. So for the driving car, we will require a petrol. We will require a driver. We will require our tire. Our tire should be not punctured. Okay. So everything should be in balance. So as for the any system to be work in our body, everything should be balanced. So here we are talking about something which cause the glucose abnormality, which is diabetes. So glucose should be balanced. Sorry, yeah.
Yeah.
Yeah, so our glucose should be balanced. So in the type 1 diabetes, what happens? There is a fluctuating blood sugars, okay? So there is
Just a minute.
so there is a hypoglycemia.
Yeah, Dr. Manoj, you can continue.
Yeah, so there is a hypoglycemia and there is the hyperglycemia. So hypoglycemia, it causes the damage to our neuron, which is regulating our sexual health. Second, the main thing is hyperglycemia. And how does it affect? Hyperglycemia can cause the oxidative reactive stress, which cause the like some abnormal toxic product to be deposit in our body. and it cause the damage to our vascular, which is the penile or urethral artery supply, and by that it cause the by that it affects our sexual health. So hypo and hyperglycemia.
Just a minute, Dr. Manoj, you also got muted. Please unmute yourself.
So shall I repeat it again?
You were saying from the hypoglycemia and hyperglycemia, we understood about the oxidative stress after that.
Yeah. So from the hypoglycemia and hyperglycemia perspective, hypoglycemia can directly damage to our brain, and the hyperglycemia can cause deposit some toxic product in our body, which damage the vessels to our penis or our vaginal blood supply. And by this all the complex mechanism, it caused erectile dysfunction in men and loss of libido in female. So this is both are dangerous. We have to be a balance.
Great, wonderful. Thank you, Dr. Manoj, for sharing it with us. That hypoglycemia and hyperglycemia both impact our sexual health. Now, one thing I want to ask is, when we say fluctuating, there are sometimes when they're fluctuating during the sexual health, and there's sometimes there is major fluctuation throughout their month, or let's say 3 month cycle when we check our HbA1c. There are two kinds of fluctuation. So now my next question is to Dr. Sanket. We have two kinds of fluctuation. One is instant fluctuation during the sexual relationship when it is being formed, and second is fluctuation throughout your 3 months. So how are both of these fluctuations different, and how do they impact the sexual health of the person? You will have to unmute yourself, Dr. Sanket.
So thank you for that question. Mainly while during the sexual activity or intercourse, if there is a dip in blood glucose, that is, if the patient or if the individual has hypoglycemia, then it can definitely impact at that point of time. Secondly, there could be a practical situation where patient has spike or spikes of high blood glucose. Probably, especially, I would like to say that because of skipping of the insulin dose on that particular day, then it is definitely going to, these sudden fluctuations are definitely going to impact the sexual activity. Because if the patients, if the individual skips insulin dose and develops hyperglycemia versus an individual who does not skip insulin dose and still has some high blood glucose levels, then in the first situation where the patient has skipped the insulin dose, then I would say that it might have an impact on that particular day. And Dr. Manisha said that when there is persistent hyperglycemia, that is what the second part of question is, that if the blood sugars are very high or fluctuating widely over the past 3 to 4 months, then definitely that can also impact on sexual activity. There could be an indirect effect also, because if the sugars are fluctuating, it can lead to some amount of distress for the individual. That is some sort of stress, or I won't say depression, but stress due to fluctuating blood sugars. And if we talk about any individual across any age group, irrespective of diabetes status, then the most common cause for sexual dysfunction is mental stress. And definitely, if there is mental stress because of any reason in a type 1 diabetic, it could be directly due to type 1 diabetes itself. And then that can impact indirectly on the sexual dysfunction. So I think both the situations, the rapid fluctuations on a given day, as well as over a prolonged time, can have an impact on
Thank you so much. What you shared about mental health is very important. And I totally believe that I was discussing one day with Dr. Manisha also about this. If your sugars are high and you are not in the position of going forward with the sexual activity, communication is the key to anything, which Dr. Manisha said. The problem is we are not communicating. Low sugars don't beat yourself up that my sugars are low. Oh, I'm not giving enough to my sexual partner. It's all about communicating enough to your partner that right now your sugars are low, which can definitely be treated and you can go back to your sexual activity. Alternatively, if your sugars are high, communicate that right now I am not in that position, and maybe you can be in that state some other time. So communication is the key. And now my next question is to Dr. Hitesh. Dr. Hitesh, are there any specific symptoms related to sexual health that people with type 1 diabetes should be aware of?
Basically, the symptoms which we have already discussed, like in male, the loss of libido, erectile dysfunction, premature ejaculation, retrograde ejaculation. These are basically the complications of the uncontrolled diabetes. So these are same in most of it. The only thing which I really want to stress here, when we are for especially for female, like there is a painful sex, then there's this loss of lubrication. Patient can have loss of libido. The only problem, the thing is that like once the patient is transitioning from childhood to adolescent, they must be treated about they must be counseled about the sex education and STD, which you are forgetting here. STD is one of those things which we really need to counsel them. And since they are diabetic, so chances of getting an infection and not getting it treated, that can result into complication, is a major thing that we need to give to our patients, that you need to be aware of this thing. There's specific, there's one disease in the male which we need to know, Peyronie's disease, in which if there's a scar in the penis, then the erection result into a painful erection, and that can be a very painful for male. So you have to be knowing about that thing.
Thank you, Dr. Hitesh, and thank you so much for covering STD. Most oftenly ignored, any kind of infection in type 1 multiplies at a speed which is not for other people because of our sugar fluctuation. So if you
Exactly.
any kind of infection, uh, like especially recently married girls, they go through UTI, but they are scared to talk to anybody about it, not even to their doctors. We need to be careful because a small UTI infection can also lead to hospitalization. So it's important to talk about your infections to your sexual partner also. Don't, even if you're newly married or in a new relationship and you feel that I should still go forward with my sexual relationship irrespective of having UTI, understand you are not only harming yourself, you are harming your sexual partner also. So communication to the partner and to the doctors is very important. Please make sure, be open about this communication, and don't worry, your partner will not judge you. If the partner is supportive, they're not going to judge you. And if they're not supportive, anyways, they're not worth being the partner. So it's important to take care of your health first and then going for the sexual relationship. Now, moving forward, I have a follow-up question to Dr. Manisha. Dr. Manisha, are there any medications commonly used by individual with type 1 diabetes that could impact sexual health? Especially people ask that, is taking insulin safe? Does insulin impact sexual health? So are there
Absolutely
any
not.
medications that type 1 diabetes take which can impact sexual health?
Usually, insulin per se, if you talk about, it does not impact sexual health for sure. And the other medication, to best of my knowledge, I don't know the medication impacting sexual health. If any other doctor would like to give their inputs in this.
Yeah, I would like to give my inputs. It's not the medication related to diabetes, since we know in type 1 just insulin is the treatment. Insulin itself per se don't do, as you said rightly. But there are complication which develops as they grow up. Like the patient is having bad profile, lipid profile, so they'll be on statins. If they're going to be having blood pressure, they'll be on the medication to reduce the BP. So these are the medications that can cause lots of erectile dysfunction. There are common medications like statins. I've already mentioned that captopril that can cause. Then some patients who are have on anti-epileptics that can cause erectile dysfunction. These are the common medicines which are along with the diabetes can cause it. Like patient is on antidepressants. If patient is having some kind of depression, psychosis issue, then this can cause. So this can be adjuvant. It's not just per se treatment for type 1 diabetes will cause the loss of libido or loss of
Just to add on, all diabetes, all hypertensive medicine does not cause erectile dysfunction.
all exactly.
It's only the beta blockers. So You need to be very specific. Is only the metoprolol or that group? Otherwise, people will stop taking their hypertensive
No,
medicine.
that's what
Their
I'm
blame
saying.
would
Like,
be
we need to discuss about the side
yes.
effects of the medication to the people.
Yeah.
If
So and
somebody is on
there are some
diuretics,
like sertraline and all is used in case of PME. So it's not. And once we are dealing with antipsychotic medicine causing this, so the hyperprolactinemia needs to be ruled out before you're giving any medicine to the patients in terms of treating their sexual dysfunction. So like medicine जैसे दवाई होती है ना, हर दवाई का कुछ कुछ साइड इफेक्ट होता है. जैसे हितेश वुड एवरी टाइम से ज्यादा पानी पीने का भी साइड इफेक्ट होता है, गोलगप्पे खाने का साइड इफेक्ट होता है which nobody would talk about. So
exactly.
everything comes with comes with the some pros and cons. So we need to take effectively, but insulin हमेशा लगानी है, वो नहीं बंद होना चाहिए, स्पेशली फॉर ऑल टाइप 1. तो वो नहीं करेगी सेक्सुअल डिस्फंक्शन फॉर श्योर.
Dr. Ovis, you wanted to add something?
Yeah, I just wanted to add that like sometimes we give medications for like somebody has a proteinuria. So we give these ACE inhibitors. Most commonly we give this ramipril. They can cause sexual dysfunction. So we should not say that antihypertensives. Sometimes we give these medicines, the person may not have high blood pressure, but we are specifically giving this medicine for proteinuria. Similarly, as you said, beta blockers can cause, but the message here should be that insulin doesn't cause sexual dysfunction. That should be the mass message here. Insulin is something, I don't think insulin has any major side effect except low blood sugar or maybe weight gain.
Yeah.
Yeah,
Thank you.
yeah. I want to add something. Many doctors are using SGLT2 inhibitor, which has a effect not dependent on the insulin, and for their obesity and for their blood pressure control. So if it is used in type 1 diabetes or in type 2 diabetes anyway, so sometimes it can cause the UTI, and by the recurrent UTI, it can damage the nerves and the vessels. So these are the medicines that can that have a negative impact on the sexual health.
Thank
But
you.
you know, SGLT we do not usually give in type 1 because of
Yeah.
fear of euglycemic ketoacidosis. And
Yeah.
second thing, with SGLT, though I'm a huge prescriber of SGLT, if you maintain urine hygiene, that's we usually say every time we prescribe SGLT, we keep on saying, keep maintain the urine hygiene, drink plenty of water, and initially they might have polyuria. So that if that precaution has been taken care, it does not cause much. But
Yeah.
if patients persistently their sugars are high, then it might give, along with high sugar, it might give them UTI as well. So everything is like connected together.
Thank you so much. So I have two key takeaways. First, insulin doesn't cause any sexual health problem. Second, you don't only have to take care of your diabetes, sugars, but your cholesterol and other things also, because all other medicines are going to be, statins are given for cholesterol, beta blockers are given for cholesterol, kidney, polyuria. We have to be taking care of your entire health. It's not just diabetes. Lot of people ask me, I'm sorry, a little off topic. Lot of people ask me, Mehek, once we know how to take insulin, why do we need to go to doctor again? That is why you need to go to doctors again, because it's not just your HbA1c, it's your entire health, which is your cholesterol, your kidneys, which doctors will be helping you take care of. So never ignore your other health function. Please go for your monthly test also. Now, moving forward to very important question from Dr. Ovis. Dr. Ovis, what treatments are available for sexual dysfunction in people with type 1 diabetes?
Yeah. So in case of males, if a man is or a male is affected with say loss of libido, we have these medicines called as phosphodiesterase inhibitors, which is like commonly given is the Viagra, which is basically sildenafil citrate. So like Cialis, tadalafil, these medicines are used in males commonly. Not just in type 1 diabetes, but these are the treatment options which we have for erectile dysfunctions. Basically, what these medicines do is they increase the blood flow towards the organ, like penis, so which is actually compromised in diabetes. There is narrowing of arteries because of lipids, high lipids, cholesterol. And so in case of females, the common the problem is the lubrication. So There are some, vaginal gels that can be used, which are commonly, available over the counter. And some females may actually have estrogen deficiencies. Those needs to be evaluated. Some females may have estrogen deficiency, and they need some estrogen therapy in the form of either injectables or tablets, or even locally in the form of gel also, which can be given. So some of them also need some antipsychotic drugs are also sometimes given. Antidepressive drugs are also sometimes given for erectile dysfunction, particularly in males. They come in combinations with these sildenafils or these tadalafils.
Okay. Great. Thank you, Dr. Ovis. Just one question follow-up. I would like you only to answer that. If a male or a female want to get these drugs prescribed, should they go to their endo or should they go to a sexual health practitioner?
I think these medicines can be prescribed by any general practitioner. You don't have to specifically go to a specialist endocrinologist or a diabetologist. But if they are following any endocrinologist, they can discuss this problem, and we can, anybody can prescribe them. But sometimes, even after prescribing these molecules, we don't see results. At that time, we sometimes refer them to usually a psychiatrist who also deals with these sexual, problems. They deal with, so it is basically sometimes there cannot be any organic problem, like a person may not have any damage to arteries or nerves. Then sometimes the problem is somebody has an anxiety issue, like a performance anxiety. He may get an erectile dysfunction. That time, I think it is better to be seen by a psychiatrist. But
Right.
he should first come to the primary physician. If the primary physician thinks that he needs a referral, then he can go. But these molecules can be given by any general practitioner. In fact, in India, I don't think you can go to a pharmacy and buy these molecules.
Okay.
Yeah.
So
I
you
want
can,
to add I want to add something if I am allowed it.
Yes, yes,
Yeah.
doctor.
So yeah, so what doctor you have to go? The doctor which know diabetes and which know the hormones, that is the best option, because it is not about the medicine. Okay, it is about to understand you what is the pathophysiology and what is the root cause. So if the doctor, if they are just prescribing you medicines, then you have to be worried, because it is not only about the medicine. You have to need to understand all the things, that why it occurred, how you can prevent it. So everything should be counseled. So that doctor who specially managing diabetes or hormones issue, that you have to go.
Great. Thank you. Thank you, Dr. Manoj, for adding on to that. Next question is to Dr. Sanket. Dr. Sanket, how does type 1 affects pregnancy and fertility?
Yeah. So before I go to that question, just one small line about the previous question, that like Dr. Oves said, there are several medicines which should go for, but don't go for over-the-counter medicines that are available in pharmacies which have no evidence at all. And there are many medicines which are available online on Insta and all those things. So one should not go for them. One should just consult their doctor, because lots of medicines are there which may have some side effects also.
Yeah.
So that was one thing I wanted to add.
Yes.
And since the topic is taboo, patients will always try on their own rather than first talking to their doctor.
Definitely.
Now, my question was about infertility and diabetes. So, diabetes is a well-known cause of infertility. It's a contributing cause for infertility, and definitely a type 1 diabetic individual who is planning to conceive, uh, they need to always plan their pregnancy. They need to consult their diabetologist or endocrinologist. Just when they start thinking about it, the partner and the individual, they start thinking about planning a pregnancy. From that stage onwards, they should be planning, because they need to get their blood glucose well under control, their insulin regimen. They need to understand what are the possible problems they can encounter during pregnancy. And before getting pregnant, they should get screened for certain complications, like especially eye disease and the urine proteinuria, which Dr. Uwais mentioned. So these are certain very basic things that should be taken care of, but they should always just plan it. And as doctors, whenever we see a couple having type 1 diabetes, one of them having, we always tell them that please plan your pregnancy. Don't allow it to happen so you have to plan it. That is the single most important message that we give each and every, because there is a lot of anxiety if they get pregnant, and if the HbA1c is on the higher side, then it has associated a lot of medical issues also, but a lot of anxiety also throughout the course of pregnancy. So that needs to be taken care of.
Definitely. Thank you, Dr. Sanket. We had one of our discussions where we had other doctors also. We talked about having a preconception counseling, which should become a norm in India now, that we need to stop. Most of the Indians, whether diabetic or non-diabetic, have accidental pregnancies. It's time we should shift from accidental pregnancies to planned pregnancies, because even if a female doesn't have type 1 diabetes, still during pregnancy, if it is planned, we can plan about the diet and lifestyle beforehand and give better care. So definitely very important point, Dr. Sanket. Thank you so much for sharing that. Moving to next question. Next question is from Dr. Manoj. Dr. Manoj, can you share lifestyle and dietary recommendation that can improve sexual health in people with type 1 diabetes? Okay, Dr. Hitesh wanted to share something.
Yeah, I just wanted to add one point in the infertility part. Like, we know, like the patients with type 1 diabetes, they also have thyroid problems. So in the case of female who are not getting pregnant or going to be having recurrent abortions, they should be ruled out for the hypothyroidism for the first. Even the subclinical hypothyroidism need to be treated in them. So we need to make sure that the patient knows that their thyroid profile also makes a great part in their fertile period.
Great. Thank you. Thank you, Dr. Hitesh, for adding that. Definitely a very important point, because many type 1s also have hypo or hyperthyroidism with it. So it's a very good point you shared. Thank you, Dr. Hitesh. Dr. Manoj, the question is, can you share any lifestyle or dietary recommendation that could improve sexual health in people with type 1 diabetes? You are on mute, Dr. Manoj.
Now am I audible?
Yeah,
Yeah.
you are.
So this is the most important things that we have to do. And if we are talking about the diet, then diet is the most important things. Okay. So how you have to manage the diet, that is a general diet. It is not specific something about the about our sexual health. So suppose people, the myths are that if you take a lot of the soybean, then some sexual problem will be occur. So it is not the truth. What you have to do, you have to take maximum amount of protein that you can take. The carbohydrate should be not less than 40 to 50%. Okay. And if we are talking about the fats, then the fat should be like 20 to 30%. So this is the general scenario that everybody has to follow. If I talk about our normal diet, which is available in our plate, then we have to take plenty of the vegetables. Okay. Which will make which will not cause you that much hypoglycemia, which reduce your glycemic index. That you have to do. Second thing, you can take fruits. Like the fruits has very nice amount of the vitamins that you can take. But suppose if it is causing hyperglycemia, that you have to then you have to calculate your carbs counting, and you have to take that much amount of the insulin. And if you have a celiac disease, which is very most common in type 1 diabetes, then you have to be particular about the celiac diet in type 1 diabetes. If you have hypothyroidism, then you have to take the medicines. So these are the things that will manage your diet and improving your sexual health. If we are talking about our exercise part, then it is very beneficial. So how exercise will work? So it will improve your blood circulation. And if we are talking about the sexual dysfunction, then it is all about our blood vasculature, not normal blood supply. So by doing exercise in combination of cardio with strength exercise will improve our vascularity. So these are the two major Dr. Heath,
Hello,
yeah.
I wanted to add something on soya products, as you mentioned. I went through an article like what is the concept behind eating too much soya. Basically, it says when you take a lot of soya, then the estrogen level increases, and that ultimately result into obesity. That can another be a cause of getting it. Like once you get obese, the testosterone level decreases. So this is a thing which they hypothesize or it is proven. That's why they say if you are consuming soya as a protein source, it should be limited. Because if you're just taking soya, your estrogen levels increase, especially in the male I'm talking about. So that was the thing which I read and I wanted to mention here.
So I want to put it light that the soybean has a content of phytoestrogen, which is not very active estrogen. Okay, and how does it cause if you are taking 1 kg soybean per day? Then it convert into that, and it will depress your testosterone. If you are taking 100 gram of soybean every day,
It won't affect
so
nothing.
if you are taking every day 1 kg, then definitely it will impair your sexual function, but not 100 gram. I think nobody is taking like more than 10-20 gram because it is very heavy to eat.
Thank you, Dr. Manoj. So first thing I want to mention, I hope all of you heard clearly, Dr. Manoj didn't say anything that is restricted. So type 1s are not restricted of anything. You can eat 40 to 50% of carbs, which is a very good carbs of your calorie intake. When I say 40 to 50%, if a person is on least 1200 calorie diet, that also makes it to 600 grams of carbs a day, which is wonderful. Means you can eat your chapatis, rice, potato, everything. It is all healthy. So diabetes is not about restricting your diet. What he says is that add more fruits and vegetables. Fruits for your vitamins and vegetable for your fiber intake. Exercise so that there is more blood flow. So I would like to repeat, lifestyle is very important. Please follow it irrespective of having any sexual health disease or not. If you have type 1 or not, lifestyle is very important for all of us. Now, taking it forward, next question I have with Dr. Hitesh. Dr. Hitesh, can you provide insight into any, if you are familiar with any latest research on sexual health and type 1 diabetes?
No, I'm not. It's like already the research part has been mentioned by Dr. Oves that they've been doing. It's nothing specific for the type 1 because like once we talk about a type 1, they get to be after the certain age, type 2 and type 1 have similar sexual problems mostly. So it's nothing specific in that particular field.
Okay, so I'll move to the next question, which is again to you, Dr. Hitesh. What role does cardiovascular health plays in sexual health and how is it influenced by type 1 diabetes? Because, yeah,
I'll
Dr.
add on to the previous question. There are few
FST.
research studies have been published, especially not for type 1. There are few I've read it when I was writing my article. So there are few for type 1, though they're not much study because of social taboo, people really do not talk about it. And as I said earlier, the people like especially the women, they do not know what the orgasm is, what the actual lubrication is. And I was doing the study, so I got all funny answers, and they used to come and ask me every time. So I was wondering, there's so much, though we are number one in population and we hardly know anything about the sexual health and how everything was. We are just, एक मशीन जैसे है, बच्चे बन रहे हैं लेकिन और क्या हो रहा है, nobody knows. And we consider कि नहीं, अगर especially in type 2, like 40s and 50s, they hardly make any relationship. So there are studies, and further study needs to be done. And we certainly, from Empower Type 1 group, we should plan some study in this regard. I'm really looking forward.
Definitely, Dr. Manisha, you lead it, we'll support you. So
It's already done on FSG, female sexual dysfunction studies. You can see her paper.
we need more studies. We'll support you in whatever we can. Thank you so much. So next question was on cardiovascular and
Yeah, getting back to that particular question, cardiovascular health. Like as we always say, the complication associated with the uncontrolled diabetes, which affects your cardiovascular system, your kidneys, your eyes, your nerves. This is one of the major things it can cause. Once your cardiovascular system is affected, your heart, the pumping machine, it's like a pumping machine which pumps blood throughout the body. So what happens once your cardiovascular system is affected, your blood vessels are getting damaged because of the glycemic variability or uncontrolled hyperglycemia, and that can ultimately result into nerve damage. this can all result into a dysfunctional sexual health. So there is erectile dysfunction associated with it and other problems associated with it.
Thank you, Justin. Thank you, Dr. Hitesh. So yes, cardiovascular health. Also, anyways, the medicines you will be taking for your cardiovascular health are also very strong. And plus, if the diabetes is uncontrolled, it will impact your sexual health. So we need to take care of our heart, definitely, especially the heart we going on. We need to take care from disease as well as heartbreak. Now, moving to the next very important.
And there is another saying: if the sexual dysfunction begins to occur, that means it's impacting your micro vessels, and it will have an impact on the major vessel also. That's the heart. So take care this now to take care of that part. So this is
So it's a
we usually
reflection, like,
correlate in our clinical practice. Yes.
so if you have some sexual issue, then you have to look at your heart, which is very, very important things, because that blood vessel is already affected, then you have to look for heart. It is mirror effect.
Yes.
Matt, I want to add one point here, like, sorry to interrupt. I want to share one practical real life, a case. So I had this 25-year-old boy, and he got married. Like, I was not aware of that. And he had a sexual dysfunction. He had erectile dysfunction. So he did not talk about it. And when he came to me, and generally I asked him, like, he said he's married, and that marriage did not last long. So that marriage resulted in a divorce. So since there was a lack of communication, neither he asked for a professional help, nor I tried to initiate it, because as I said in the beginning, that what should be the right time where we should actually talk about it. Like, premarital relationships are common, though not public. People don't know about it. But so this was something that I felt like, today I was thinking about that, and fortunately that person has joined this session today. I can see a lot of my patients have joined today. It's very I'm just wanted to give a message here that you should talk about sexual dysfunction of any type, whatever we discussed, whether this is in males or females. You should talk to a healthcare provider, and we have treatment options. Like, he had an ED, he got divorced because of ED, which is very unfortunate. So yeah.
Very important point, Dr. Ovis. In fact, when I was in my legal practice, a lot of cases used to come where divorces were happening because of ED. And when we talked to the male counterpart about why it is happening, they said we don't want to talk to doctor or anybody about it because they were ashamed that their friends will make fun, their family will reject them, or what will happen, and they would never talk. So it's a very, very important point you have said. Please.
I think one point that I can add here is that when we come to know a person is a relationship, I think it is better that we ask that person, you should bring your partner along when we are giving treatment. So I think the conversation should start then. Like, these problems may happen, and we have treatment option, and that needs to be discussed with us so that we can give a better treatment, or we can help.
Definitely. Very, very good point. Very, very good point. Thank you so much, Dr. Ovis, for sharing that. Next question is again very important and very, very thank you, A.K. Vidwal sir, for asking this question. Can the time of menarche and menopause be affected because of type 1 diabetes? We have seen early menarche happening and early menopause in type 1s. So is it because of type 1, or is it something that is generally happening? Dr. Manisha?
Yes, regarding the menarche, I would ask Manoj. Manoj, we have a pediatric endocrinologist here, and I request Manoj to answer this regarding the menarche. What happens in type 1?
Yeah, the menarche in the type 1 diabetes is majority delayed menarche. Okay, so delayed puberty. And why it occurred? This is due to the means delayed menarche is CDGP in another term. What is the CDGP means? Because of your sexual
Manoj,
axis.
elaborate the term CDGP. They won't understand.
Yeah. So what is the CDGP? CDGP, that means the condition where your sexual axis is not activated. Means because of some outside factors, your body is not giving message to your brain that you have to start this process, and which is very, very common in type 1 diabetes. So it is the term as a CDGP or delayed menarche. So again, it is not a pathological, like it is not congenital or not due to some serious illness. It is generally due to this hyperglycemia and hypoglycemia imbalance. And if you are not getting menarche in some cases, then you have to be worried, because it can cause some another type of severe disease like APS and APS2. So you have to call your doctor, you have to meet that doctor why it is not occurring. So all the 95% causes are ruled out. Then you have to think about some other autoimmune condition, which can affect 2 or 3 endocrine organs.
Yeah, so like hypothyroid or celiac needs to be ruled out before
Yeah.
you're diagnosing any patient with delayed
And there
puberty.
is possibility of APS2 as well as, so that we have to
Mhm.
take into consideration.
That autoimmune polyendocrine
Polyendocrinopathy syndrome.
syndrome.
Yeah.
So regarding the postmenopausal thing, postmenopausal is when there's complete cessation of periods, and usually this can happen at any age. So diabetes will not cause this. There's early stopping of periods, and after 40, any woman can experience this. कि भाई 40 के बाद आपको कभी भी पीरियड्स बंद हो सकता है, लेकिन उसके सिम्टम्स 2-3 साल पहले से आते हैं. लाइक दे माइट हैव सम हॉट फ्लैशेस or irritability, depression, anxiety, or they'll go very hyper at times and very low. So that needs to be handled well, and there's certain medication which really calm them down. So it is important. But diabetes में menarche जब start हो रहा है तब sugar का control होना जरूरी है, plus another needs to be ruled out. Regarding the postmenopausal, that's a phase, and that's how the body is retiring from the like from the hormones. So that needs to be handled well, addressed well.
Just one point I want to add here. Some people may get a condition called as premature ovarian insufficiency, which is also an autoimmune disease, which may also happen in type 1 diabetes, because that is also an autoimmune disease. Most common cause of premature ovarian insufficiency is autoimmunity. So they may see their periods may cease before 40. So that also is something that we need to consider, like early menopause. There could be a premature ovarian insufficiency, and they may have more sexual dysfunction. And those people need more attention. They need more. These treatment options are actually for those women as well.
Thank you, Dr. Ovis, and thank you everybody for taking it. Next, somebody has shared that he has type 1 from last 13 years and he's divorced. I will tell you, I had one wonderful conversation with Dr. Manisha, which I'll be releasing soon. When we say that we are type 1 and we are having divorce, every divorce is not because of type 1. Sometimes the relationship is not, if you're having divorce, just post the diagnosis of type 1, that can be because of type 1. If you're into the relationship for a long period of time, and over a period of time something happens, let's say anything that happens which you are not communicating enough, that is causing the divorce. So what happens with us as a type 1, we are in the habit of blaming everything to type 1. Even if it's for me also, if I'm not getting the job, no, I'll say, oh, because of type 1 I was not putting the effort. If anything, if I'm not succeeding in life, type 1 will come as a very good excuse. What we need to know is everything is not because of type 1. Until it is just post diagnosis it is happening, I totally understand. But if you are into relationship for 6-7 years, if you're into marriage for 6-7 years and then divorce happens, I think it's mostly because of lack of communication. And like Dr. Ovis said, we need both the partners together in the clinic when we are talking about anything, so that we are always preparing the other person, especially in case when the other partner is non-diabetic. So thank you so much. I have one last question to all of you. Okay, Dr. Manoj wanted to add something. Dr. Manoj, please.
Yeah, I want to add for 1 minute only. So if we are talking about sexual health, then we don't have to forget the bone health, because it is closely mirrored. It has a closely mirrored effect. Why? Because for our bone, we will require our sexual hormone. So if it is impaired, then we have to, our bone is no, abnormal, we can get a fracture. So it is not about only sexual health, it is about the bone health also.
Yeah, great. Thank you. Thank you so much. Okay, with bone health, there is one question that keeps coming to me again and again. Does bone health gets impacted because of insulin?
I think no.
Its answer is
Yes.
same.
Another expert person. If we are not taking proper insulin, then it has a negative impact.
Then yeah, hyperglycemia and all. As
Yeah.
Dr. always said, right, regarding the premature ovarian insufficiency, those females needs to ruled out with osteoporosis. And
Yeah.
yes, and BMD needs to be done. That is bone mineral density. If any woman having this, they needs to be done BMD. That's the test, and appropriate treatment needs to be initiated by an endocrinologist, especially.
Yeah.
Thank you.
And just I'm adding the last thing, that if you have tried every medicine and if it is not giving you positive input, then some therapies is there, that like vacuum erections, like some prostatitis, everything is available. So
Injections.
you have to talk to your doctor, and that thing that you have to take into account, and you can take a particular treatment rather than the divorce.
Definitely. Thank you. Thank you, Dr. Manoj. So divorce is not the answer. It is always talking it out. Next question is by one of my students. If one of the parent has type 1 diabetes, does the baby also gets type 1? I think any of you would like to answer? Dr. Manisha?
Yeah, so if the
Child.
mother is having diabetes, so the chances of getting child is like around some
7 to 8%.
2 to 8% or so, and the father is having
Yeah.
Yeah, if
5
both
to
parents are
7% if the father is
yeah.
having, and if both the parents are having, the chances increases up to 10%. But recently I came across, Mehak will agree to this, that she sees more of type 1 having baby having type 1 from a parent is more, though we have not experienced in our clinic, right Manoj? हमारे clinic में बहुत ज्यादा
No.
बच्चों में नहीं
बहुत
हुआ है जिसको
ये
पेरेंट्स है ना।
स्टेटिस्टिकल डेटा है, जो डॉक्टर
हम्म
मनीषा मैडम ने बताया कि वो स्टेटिस्टिकल पूरा डेटा है। ये
हाँ
हमने एक्सपीरियंस इतना नहीं किया है।
राइट
जो लिटरेचर बता रहा है कि जो बोथ पेरेंट्स है तो आपका चांसेस जो होता है 20 to 25% जैसा होता है, बट दैट वी नेवर सीन इन आवर क्लिनिक।
So I'll tell you 1 to 2% if mother has type 1, 6 to 7% if father has type 1, and 10 to 12%
Both.
parents have type 1.
Both.
Also, in Delhi, we have seen this pattern that if father has type 1, the child having type 1 chances are more. Only if father has type 1, we are seeing the child having chances more. That is why this new research came out, because in Delhi, the most cases is where the father and the child have type 1. We have, in Delhi, we have also seen both parents type 1 and child having type 1. Most likely, Delhi has bad environmental factor also contributing to. That is why we are seeing it. We are still not sure about other states. We have not seen much in other states. So it's, even if you go for planned pregnancy, I would say your chances of baby having type 1 is very less. Go forward with your pregnancy, enjoy your period, and we are always there to guide you. Okay, next question is, if husband and wife both have type 2 diabetes, then what are the chances of babies having it?
almost increased by 60 to 80%. You cannot change your parents, same like me. I think I'm already pre-diabetic.
Can I tell you something? I would say 0%.
Yes, Meg, I would come to you for my lifestyle.
Lifestyle,
I
yeah.
think it's very important question, this type 2 diabetes. See, you cannot, Manisha said, you cannot change your genes, but genes
Yeah.
get expressed if you give them that environment.
Environment, exactly my point.
You can change the epigenetics.
So, yeah, so if you are in an obesogenic environment, you are sedentary, you are overweight, even if your parents don't have diabetes, you can get diabetes. Type 2 diabetes I'm talking about.
Definitely. Very, very important point Dr. always mentioned, which I always say. Don't blame on the genes if you're not giving them the right lifestyle and the environment. So if both parents have type 2, and if you are teaching your child to stay healthy, not giving him junk, giving him proper lifestyle, making him eat more vegetables, fruits, salads, giving him, teaching him right exercise, you can take me, I'm willing to give it in writing, the child will not have type 2 diabetes. Type 1, I cannot give it in writing because there are no reasons of why it is happening. So what Dr. Obis said, if you introduce the environment factor, type 2 will happen from the parent to the child. If you don't introduce the environment factor, it will not happen. Right?
No, I disagree with this.
Yeah,
This
I
is not
also
Yeah,
about,
disagree with
like
there,
that.
if this would
even
have
I
been
in my
lifestyle.
practice also, I've
No,
seen
no,
lot
I'll
of
just tell,
patients
like,
who are physically very active.
listen. When we talk about the reversal and remission of diabetes, this is the thing where we say we just change for everything, we just stop eating, we do exercise and stuff. And once you stop doing that, that comes. Like similar with the obesity. Obesity is again when we say, like, if you give an environment that you'll be getting obese. But there is factors, you'll get back to that. Your body works in a particular way. That's what the genes comes in. And our genes will produce some or other factors that will make us go there and there. It's not like 100%. If we are in a perfect world, suppose if we are robot, we have been given this command, okay, you will eat just 800 calories whole day and then you will do exercise, then it's perfect. But we live in a world where we have stress, where we have so many factors that is uncontrollable. Just imagine, even if I go to Kashmir and start living, obviously things will be much better, but still those genes will work there. So I am not saying like the 100% is not possible, but we can make a difference.
No, definitely. See, what I meant is that fear that my child will have type 2 diabetes is already, so I believe in the power of your mind.
I do agree.
Mind is the most powerful thing. If you start anything with the fear, your child is 100% going to have type 2 diabetes no matter what you do. And if you start with the mind of empowerment, a thought of empowerment that, okay, we have it, but we'll make sure we provide the healthy lifestyle environment to you, our child, and he'll not have it. I am sure he'll not have it. And we have seen some wonderful results just by using the power of our mind. I believe you might have seen it in your clinical practices also, which is what we believe in, empowering all type 1s and type 2s also. So thank you so much. But I still have a question, which is more important. And I want each one of you to give one line answer to this question, or it can be more than one line. But I will be coming with the same question to each one of you, starting from Dr. Obis. How can partner of individual with type 1 diabetes support their partner's sexual health and overall well-being, especially in the case when the partner is non-diabetic?
So that's what I said. I think we should involve the partner in our routine clinical, practice. Like when the person is coming to us, I think that is the time where we can actually get involved with the partner so that we understand his psyche, we understand, because what happens, I know many of my type 1 who got married, did not tell their partners or in-laws that they have type 1 diabetes, and then had an accidental pregnancy, which resulted in pregnancy losses. Then that person came to us and told us, you please label us as, gestational diabetes, that some women get diabetes in pregnancy, so that I will not get a blame. I think I always tell, if a married type 1 comes to me and I tell his or her spouse that, do you know that before marriage that she had or he had type 1 diabetes? And it usually happens with females. It doesn't happen with type 1 males. I think there is some, I have seen many.
Social stigma.
Yeah, social stigma, like, yes. So I tell them that, this is type 1 diabetes. It was not in her control. Anyone can get type 1 diabetes at any age. At any age. It's not just the children who get type 1 diabetes. So I think if we, involve partners right from the beginning, no, it's not important that we talk about the sexual health on the first consultation. I think gradually we can start and we can tell them this is this disease and counsel them. I think counseling plays a very important role. It's about understanding the disease. There are people, when they get type 1 diabetes for the first time, they don't believe it, their child can get diabetes. It is just when we start talking about it, like, yeah, there is a different type of diabetes which is entirely different from type 2. So then they understand it. I think involving partners early and asking about, when are you getting married, are you engaged? I think I ask these questions, like, are you engaged, when are you getting married? Because the preconception, this counseling, I tell my patients that, your HbA1c has to be this much before you actually plan for pregnancy. I think that my, maybe let's see what others have to add to it.
Thank you, Dr. Ovis. Okay, Dr. Manoj, one tip for the partner, non-diabetic partner, on sexual health and type 1 diabetes?
Yeah, so I think the doctor always has answered that you have to take care of your partner. You have to you have to talk a lot. Okay, if you have some issue, then you can give a sympathy, or you can give some encouragement to your partner that you have to take care. And perspective of the UTI, you have to take care. That is the thing that.
Thank you, Dr. Manoj. Dr. Sanket.
So I would like to say very quick words by showing empathy towards your type 1 diabetic partner. It's very important, which was elaborated by Dr. Oves. That was in one word, showing empathy towards your partner. And secondly, the partner should start collecting information, educating themselves by from the right sources like type 1 diabetes communities or their doctors about the sexual health of the couple together. So by collecting information from the right source and by showing empathy towards the partner, because like we discussed, wide fluctuations on a given, sudden fluctuations can have impact on a given day, but may not have impact on some other days. So understanding this is, I think, the problem may not even occur.
Thank you, Dr. Sanket. Dr. Hitesh.
Communication, as you said, counseling, and educating yourself. Being a non-diabetic with a diabetic partner is always challenging. But we must understand marriage is not just about any disease, it's about the souls which we meet. And once the soul know each other, then these barriers can be overcome. And I've seen people they support, like I have seen a lot of patients. It's not about diabetes. Like the partner is supporting till the end of the breath, they are there for them. But there's a few partners who are away from them because they just don't understand the constitution of marriage. So that is like the soul should be involved, not just as a body.
Definitely, very
Very hard to find Ritesh. Soul
And
wala
it's
pyar
easy.
has disappeared.
No.
I would just add that good communication will lead to great compatibility, whether it's physical compatibility or intellectual or emotional compatibility. First, the partner needs to be emotional compatible, then they'll come to physical compatible.
Exactly.
And the women needs to be independent. As always said, na, कि बताते नहीं है, they hide their diagnosis. Why do they hide? एक तो social stigma है,
Social.
दूसरा if they
शादी
reveal,
में भी.
nobody will get married to them.
Exactly.
कोई शादी नहीं करता है, तो हम सच्चाई बता बता के भी शादी नहीं करा पाते हैं, तो बहुत सारे बच्चे हैं.
One thing
The
I
lot
tell,
of-
because, sorry, Manisha, just one thing. One thing I add to the non-diabetic partners is that, you can also get diabetes. Prevalence of type 2 diabetes is so high in India. Like if we look at the, epidemiological studies, like even tomorrow you could be having type 2 diabetes. Then she has to, when I say she, because this is a stigma with the females only, then you have to support him.
Yes.
So yeah, I think communication, most important, education, ultimately education.
एजुकेशन एंड द वुमेन जो टाइप 1 है स्पेशली हम यही सब बोलते हैं कि भाई इंडिपेंडेंट बनो, पढ़ाई करो, यू नीड टू बी इंडिपेंडेंट एंड टेक केयर ऑफ योर ओन बर्डन्स, डू नॉट बी डिपेंडेंट ऑन योर पार्टनर. तो जब इंडिपेंडेंसी होती है, दे कैन मैनेज बाय देयर ओन, प्लस द फैमिली. आई अंडरस्टैंड लाइक यू गाइज आर द वॉरियर्स, लाइक आप लोग जैसे मैनेज करते हो, हमारे लिए कहना आसान है, वेरी इजी फॉर अस टू से कि मॉनिटरिंग करो, ये करो, इट्स इजी फॉर अस. But like every day before pricking, if somebody has to monitor, it's a task. When I do my blood sugar reading, मेरा पूरा हाथ है ऐसे वाइब्रेट करता रहता है पूरे दिन. It pains. So when I see the fingers of like tiny ones, it pains. It really pains. Like मुझे समझ नहीं आता मैं क्या करूं, but that's the only thing we could offer them just for the better treatment of or their better future. So be independent or do not hide. Otherwise, it leads to a lot of complications.
Thank you so much, Dr. Manisha. And I want to tell you all one thing. We have 5 doctors here. So definitely, if you want to talk to anybody about your sexual health, we have Dr. Oves, Dr. Manoj, Dr. Sanket, Dr. Hitesh, and Dr. Manisha. If you're not comfortable talking to your own doctors, please reach out to these doctors. I know it is not easy talking about your type 1 also to any doctor. You can talk to these doctors, and these doctors can at least communicate to your endo, because I want to tell you one thing. Endo community together is very supportive. So sometimes when you're directly not able to talk to your doctor, please reach out to your diabetes educator. You can talk to these 5 doctors, and I assure you, they are going to support you. And if not comfortable talking to any doctor, I am Meg, I'm a type 1 diabetic myself. Talk to me. I don't judge a male or a female when they are talking about their sexual health, because I know it is happening with all of us. And we are all together in this. So feel free and feel comfortable talking to anybody. And Dr. Hitesh wanted to add something.
Yeah,
Dr.
just last thing, like, when I started practicing, I still remember there was an intern. There was this lady who came to me and she asked me, like, my son is going to be married and that lady is diabetic. Can I get her married? I was naive that time. I said no. Then there was this senior to me. He said, why did you say no? Do you know anything about this? So that's what happened. Like, we don't know things and we get judgment from the people who are not into this thing. And that can result into something really bad. So always entrust your doctors, ask someone who is going through it. And the good part is the counseling. Never ever take counseling from some layman. Otherwise, you are going to be in a bad hand.
So I'll tell you, Dr. Hitesh, you are not alone. A girl came to me and she wanted to marry her boyfriend who had type 1 diabetes. And they went to all the doctors in Chandigarh and all the doctors said, no, don't marry them. And this girl came to me and I said, why don't you want to get married? It's okay. It's not his fault. That was my emotions speaking. Next day I thought about it. I called that
It's
girl
not
again,
easy.
but I called that girl again and I said, please don't marry that guy. And you will be shocked at type 1 saying that, because in her entire relationship with that boyfriend, she couldn't realize that this person has type 1. Today, before marriage, she's asking me, what will happen? Anything happens to their relationship, she will blame type 1. So I said,
Exactly.
Did you say the doctors told her not to marry him?
doctors told not to marry. Yeah. So the
Quite,
doctors,
quite
which
like unfortunate if that is the case.
So
Yeah.
when to me, initially, obviously, my emotions said that how can you say no, he's your boyfriend and everything. But later on, I realized what a mistake I did. This girl is going to blame type 1 for everything. And you know what happened? This girl came to me. She said, ma'am, I'm going to marry this guy. And I said, what happened? What changed? She said, I realized all these disease can happen to anybody. Cardiovascular disease, kidney disease,
You
type
can
1,
die next moment. Exactly.
it can happen to anybody. It is just that we have created that mindset. So if I force them to marry a non-diabetic, if I force a non-diabetic to marry a diabetic, they are going to blame them for everything. So I have decided now, if anybody comes to me and asks, I'll say, if you have doubt, please don't marry. The doubt should have come on the first day of the relationship, not at the time of the marriage. So if somebody is asking me this question after 4 or 5 years of relationship, I would say, please don't marry. Because no, you are not going to spoil your life. You are going to spoil the life of that type 1. For me, that type 1 matters. So if anybody comes to you also, please tell them, please spare that type 1. Because for me, that type 1 matters. So with this, we'll end this session. Thank you so much, everybody, for joining us. If you have any question, you can reach out to any of these doctors. I'll upload this recording on my YouTube and I'll write the link of all these doctors. I'll share the link of all these doctors so that you can connect with them. Thank you so much for joining us. And thank you all the doctors. Thank you, Dr. Ovis. Thank you, Dr.
Thank you,
Manoj.
man.
Thank you, Dr. Sanket. Thank you, Dr. Hitesh. And thank you, Dr. Manisha. We'll come again next month with next topic, which is very interesting. And I hope you all join it. Thank you so much.
Sure.
Okay,
Take
bye.
care. Bye bye. Happy
Bye.
weekend.
Bye.
Mm.